Hi there. Yeah, please come in. We've been waiting for you. No, that's alright. You're exactly on time. Well, how are you doing? Okay. Yeah, sure, take your seat right in front of me. Do you feel comfortable there? Good. Okay, well, so Dr. Eclipse is at the conference. I'm Anastasia, one of her medical students. I hope that, yeah, tonight I'm gonna do your cranial nerve exam. And please don't worry. Exactly. Yeah, my confidence is more than sufficient for that, so it's totally fine. And do you have any questions to me? Okay, so I will confirm your personal data first, just in case. I suppose that we have all it right in your profile. Okay. It's actually gonna be my last appointment for today, so I'm really excited. Yeah, it's been a long day, but anyway, I do enjoy what I'm doing, so it's okay. It's quite okay. Just kidding. Well, anyway, your first name is exactly. That's what we've got. Then your last name. Could you spell it for me? Just want to make sure that the spelling is correct. Okay, wonderful. Now your phone number. Yes. Good, amazing. Now your home address. Good. And your email address finally. That's all right. Yeah. .com. Exactly. Yeah, that's what we've got. Well, anyway, tell me please, how are you feeling today? And how have you been feeling lately? Have you had any alarming symptoms? Anything that would bother you? Right. Have you had any headaches lately? How would you describe it? Is it like splitting headache, splitting pain? Is it a throbbing pain? More of a background ache, which is not that noticeable, but you can still feel it. Right. Okay. How often does it happen to you? How frequent are they? Okay. Yeah, get it? Alright. Well, on the scale from 1 to 10, how would you evaluate the intensity of this aches? Yeah, obviously, like 1 is not that bad, and like 10 is, it's really severe. Okay. Got it. Well, then, what about your neck, your shoulders? Do you ever feel any excessive tension in muscles? Sometimes it happens that headaches can be caused by, some muscle, like excessive muscle tension in your neck. Okay, I see. So you haven't noticed anything like that. Alright, have you had any injuries lately? Anything that could be... Okay. Any kind of accidents? I got it. Alright. Just give me a moment. Okay, now, what about your root hours of sleep do you usually have on a daily basis? Do you think that's enough for you? Do you usually feel energized when you wake up in the morning? Well, in most cases, you've got to sleep at least 7-8 hours a day. For some people, they say that 6 hours can be quite a sufficient amount, but in most cases, yeah, that's not enough really. Some people need even more than that. But yeah, so it's all very individual, but if you sleep like 4 or 5 hours a day, that's definitely not enough. Doesn't really matter. Well, anyway, when you wake up in the morning, like do you feel good? Do you ever have any kind of dizziness or some like flashes in your eyes? It sometimes happens that people say that. No, it's not like you're hallucinating, but still. Okay. What about physical activity on the rate from 1 to 5? How would you evaluate your physical activity, where 1 is like you don't have like any physical activities and 5 is like you do sports at least 4 times a week and you walk a lot and stuff? Okay, so how often would that be? Well, I also have to ask you about your diet. How healthy do you usually eat? Again, on the scale from 1 to 5, let's say when 1 is like absolutely unhealthy, you eat a lot of junk food, a lot of fast food, you don't keep the track of your like nutrients, and 5 is when you actually get enough protein, carbs, fats, fiber. Okay. I mean, it's quite subjective, but still. Okay, okay. Right, now, would you please tell me when it comes to your cranial nerves, like your senses, mostly your hearing, vision, sense of smell and taste, your general balance, coordination, have you changed? Have you noticed any changes? Maybe there are some things that are quite disturbing. Any troubles, issues with any of these senses? Okay. We'll check everything tonight, so no worries. But I'm just asking in case you have noticed something, some changes, some problems. So then, of course, we'll pay more attention to that and we'll test it on a more profound level, right? Okay. No, I got it. That's alright. That's quite typical. There can be many reasons for that. But yeah, please don't worry. Okay. Let me just add all this info. Patient. Okay. Good. Oh, alright. Well, I guess that we could start. If you're ready, I'm ready too. Alright, well, first I'm gonna take your vitals, so I will listen to your heart and to your lungs and to your stomach most probably as well. So you can pull up that shirt, but just a little, that will do. Yeah. Okay, great. So, just give me a moment. I will put the stethoscope on. Right. Ooh. Good. So, ready? Alright. Let's just press in and breathe out slowly. Okay, now once again, press in. Okay, and now breathe out. Okay, good. Breathe in. Breathe out. Once again, just press in. Hold there for a second. You can breathe out. Okay, wonderful. Now just turn around for a moment, please. Breathe in. Good. Again, breathe in. Amazing. And now again, breathe in. Out. Okay, good. Just a second. I just check your stomach as well. Okay, what about now? No, just relax. It's fine. Good. And just wait for a second. Oh, okay. Okay. Well, what can I say? So far, so good. Yeah, it seems just fine. I will also take your pulse, okay? If you don't mind. Sure. Okay, please give me your hand. Just relax, it's not gonna hurt, I promise. Good. Just relax, it's fine. Okay. Just keep the track of time. Alright. That's fine. You seem to be quite excited though. Pulse is a little bit faster than it's supposed to be, but that's totally fine. So since like you're in kind of like relatively new environment and new surrounding, and yeah, so that's all right. Please don't worry. Good. I will also take a pulse at the end of our session, of our exam, so we'll see if it changes throughout this time. Okay, I hope that you will be able to relax completely and it will like slow down a bit, so that's gonna be alright. Well, it also can be the reason, were you like walking here? Maybe you were like cycling? How did you get to the clinic? So yeah, that also might be the reason if you had a lot of like physical activity before, so yeah, that's totally fine. Okay, well, just give me a moment. Okay, good. Right, well, now I will touch your face just really slightly. For that, I'll put my latex gloves on. I just want to, okay, have a look at your reactions, how your muscles work on your face. And also, we'll need to check your eyesight. So I will have a closer look at your eyes. You don't mind, of course. I hope you don't. Okay, so what I'm gonna do is touch you really, really gently. So please, just relax. No need to be afraid or anxious or whatever. Are you ready? Okay. Can you feel my hands symmetrically on both sides of your head? Good. What about now? What about breath here? Okay, wonderful. Now can I have a closer look at your eyes? Could you please close them for a moment? Okay, now you can open them again. Good. Do you mind if I use some lights? Okay, could you please look up? And now look down. To the left. To the right. Amazing, you're doing good. Now once again, please look up. And look down. And look to the left. And look to the right. Now blink. Good. And now blink. Wonderful. Okay, good. Now, let me have a closer look at your nose and your throat. Just a second. Like that. Okay, good. Now I will just use the spatula to press on your tongue a little bit. Say ah. Good. No, that's alright. Have you had any colds lately? Good. Okay, now I will ask you to follow the light for me, okay? That's a pretty typical test. I hope you don't find this light too distracting or too bright. Just relax. Yeah. No, I'm doing exactly the same procedure. We have the same protocol, so everything what Dr. Eclipse would do. Okay, now I will ask you to tell me when the light appears in your field of vision, okay? Just look at me, look at my nose. Thank you. Okay. Good. 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 Wonderful. Wonderful. Okay, good. Now I'll ask you to keep on looking at my nose and tell me how many times the light appeared and disappeared in your field of vision. So we'll test both your vision and your ability to focus. Okay. Good. Okay, wonderful. Four times. Okay, great. Now, look at my fingers. Okay. Follow them with your eyes only. Don't look, don't like move your hand, okay? Just look at my fingers with your eyes and move your eyes only. Try not to move your hand, okay? Okay, wonderful. Now, please look at the light. And you concentrate on it. And tell me how many fingers I'm holding up. such a way we're gonna test your side vision, your peripheral side, okay? Mm-hmm. Good. Oh, 2, 3. Okay, wonderful. Good job. Now, please tell me, what color do you think it is? Blue. What about this one? Red. Good. Please follow the red light for me. Good job. Good. Now please follow the blue light. That's alright. You're doing pretty good. Now, what about this color? It's green. Okay, so look at the green light. Now just concentrate on it. Ignore the red one, please. Okay. You're doing good, actually. Okay. Now, please look at my nose and tell me why my fingers appear in your vision. Okay. Okay. Now the same thing, but just tell me when they disappear from your field of vision, okay? Good. Okay. Okay. No, good. That's fine. Good job. Now, since we started checking your eyesight, I've got a Snellen chart for you. I will ask you to read some of the lines, okay? Could you please read line number 4 for me? That was a piece of cake, right? Okay, now please read line number 6. Good. Okay. No, you're doing good. Now please read line right above the green line here. That will be number 7, right? Yes. Oh, did I say above? I'm sorry, I meant below. Okay, well, like I said, it's been a long day, so sorry. Probably my concentration isn't as good either. Okay, so that's all right. Good. You have a phenomenally good sight. Well, anyway, now let's try to do the same thing, but with one eye closed. Okay. Good. I will just give you this thing, and you will use it yourself. Okay. Here you go. Okay. Are you ready? Okay, so could you please read line number 5 with one eye closed? Good. Okay. Now please read line number 6 with another eye closed. Okay. Well, let's read line number 5 once again. Okay, good. Good. No, you're alright. Doing good. Okay. some Ishihara plates for you. So let's have a look at them. Can you see anything inside this circle? Okay, good. What about this one? What about this one? Okay, good. Let's test your color blindness in more detail, okay? What color is this? Good. What about this one? Good. Oops. No, I'm sorry, I just have so many cards, it's hard to navigate through them. About this color. Good job. What about this color? Ooh, so nice. This. It matches my stethoscope, right? This one matches my shirt. Good. About this one. Awesome. This one. Okay. This. Good job. Wow, you're doing good. Of course, it's red. Yeah, something like that. Okay. Now, you might have noticed that some of these cards were basically with the same colors, right? So some of the colors, some of the shades were repeating. Now, I would like you to tell me if you can see any difference between these two cards. I mean, both would be called pink, but can you see any difference? What if I bring them closer like that? Can you see it now? Which one is a little bit darker, a little bit more saturated, in your opinion? This one. Now I have two more other cards. Just a second. Alright, so let's have a look at these two. Can you see any difference between them now? One is a bit lighter. Which one is that? If I bring them closer, has anything changed? Does it look the same to you now? No. Okay. And two more cards. Oops. These two. Can you see any difference in shade? What about now? Which one is lighter? This. Okay, good. I actually have a lot more stuff here with me. Okay, let's just use a few more of them. We're not gonna use all of them today because it's not really a specialized eye exam, so we don't need to delve that deeply into it, but still. Okay, what can you see now? How many cards can you see here? 4 of them. What is this? About this. This. Good. Now, have a look at them once again. So, tell me please, which one have I taken down? Yellow circle. Okay. What about now? Which one is missing? Do you remember the color or the shape, at least something? Ooh, green triangle it is. Good job. Okay. What now? Blue diamond. Good job. Well, you're doing good. I promise. Okay. Please let me type in results. Okay, and now we'll proceed to your hearing test. Okay, so I'm gonna check your hearing. Right. Are you ready? Good. So please concentrate, okay? Good. I will make some snips. Some snipping sounds. You have to count them. Don't look at my hands. No cheating, okay? Good. Okay, 3. Good. Do you have them? Okay, fine. What about now? 4. Okay, what about now? Just 1. Okay, what about now? Good. Good job. And what about now? 6 of them. Okay. Now please tell me if the rhythm is even or not really, okay? So if the pauses, the intervals between steps are the same or not really, okay? Good. You will understand, I promise. Good. So, what do you think? Okay, good. What about now? It was not even. Okay, good. What about now? Okay, and what about now? Good. Okay, wonderful. So now please tell me which side the snaps are on. Okay, and now? Good. Okay, wonderful. Now tell me how many snaps you can hear and which side they are on. Okay, good. Good. Okay, wonderful. And please let me have a look at your ears with another scope. Don't worry. Okay. Is it alright? Good. Now, Good. Amazing. Now everything is alright. Just give me a moment. Good. Okay, wonderful. So now, another thing I'd like to do is to use this wooden sticks, okay? So you will let me know how many sounds you can hear, okay? Good. Alright. What about now? Okay. What about now? please tell me which side the sound is on? Which ear is it closer to? And what about now? Okay, good. What about now? And now? Okay, wonderful. So now I will whisper some words for you, and you will let me know what you've heard. Okay, good. Orange, tangerine, cinnamon, lilac, sunflower, cornfield, Coca-Cola, apple blossom, cherry jam, apricot tree, peanut butter, purple. Now the blue sky, 26, 44, 55, 250, 531, 600. Okay, well, still pretty good. Good. Well, now, let's check some other things related to cranial nerves, right? So, I have some testers that will help me to check your olfactory nerve and some other nerves which are related to your sense of smell and taste. So smell is most olfactory, and for taste there are like 3 nerves which are responsible for that. Okay, let's start with sense of taste. Please don't hurry, that's alright. Seriously, there is no hurry at all. Take your time, it's okay. So tell me please, what does it taste like? Are you sure? Let's try again, okay? 1 second. So it's just open. So what do you think? Banana it is. Good, good. Wonderful. Now let's try this one. So, do you have any idea of what it could be? Good. Okay. Now let's try one more. Okay, this one. So, what do you think it is? Coconut. Okay, good. Why are you so hesitating? You actually were right. So, but you should be more self-confident. No, that's all right. Just give me a second. Now your sense of smell. So, I have some substance for you to smell. Ready? Take a smell. No, just give it a smell. That's alright. Good. So, what do you think it might be? Cherry. Good. Right. Absolutely. Okay. Let's try something else. Okay. Well, now another one. So here it is. Give it a smell. So, what does it smell like to you? Rose. Right here. Good. And let's try one more. Good. So what about now? What do you think it is? Apple. Good job. Okay. Wonderful. So, just give me a moment. Just enter all the information, all the results of yours. Good. Now, your reflexes. Good. So, just try to relax. Okay, your wrist. Good. That's alright. Now you need your reflex. Put one leg over the other one. Exactly. Good. Now switch them, please. Okay, wonderful. Now your elbows. Good. And okay, just a second here. Good. Okay. Oh, good job there. Now I'll also check your skin, synthetic sensation, sensitivity, if you can feel. Okay. So I have a few brushes, right? So I will touch you either with a soft brush part or with this tip. Okay. Are you ready? Good. You will just tell me if it's soft, like dull, or sharp. Good. Okay. So. Okay, good. And what about now? And what about now? Good. And now, what about now? Okay, wonderful. And what about now? And now. Okay, good job. Oh, you're actually doing good. Okay, well, I guess that we are actually done for today. Thank you so much for coming, for being so punctual, for actually taking care of your health. It's extremely important, and I do appreciate it when patients do it. Yeah. Even as a medical student, without having that much experience, like, I can tell that it's definitely better to, to prevent something than cure it later, try to treat it. So, for sure. Good. Now you actually are doing great, but we'll send you all the results with the whole conclusion, the whole summary, a little bit later. So we have your email address, so I guess that will do. Okay, good. Well, once again, thank you so much. It was a pleasure to work with. Yeah, it was a pleasure to work with you. Okay, well, I'll see you later. Thank you. Bye. Hello, are you here for your cranial nerve exam? Well, that's what I thought. You're exactly on time. Before we start, I'd like to ask you, how have you been feeling lately? Have you got any complaints regarding your senses or any other alarming symptoms? Have you had any headaches lately? Any pain around your neck, your chest? Alright. Well, I think that I might have some extra questions for you in the process. But I think that in general, we could give it a start. And I will take your vitals first. So I have a stethoscope here. I'm gonna use it in order to check your heart and your lungs. And sometimes we also use it to check on the stomach. So I guess that if you're ready, I'm ready too. Could you please pull up that shirt just a little bit? Thank you. Okay. I will give you some instructions in the process, right? Well, so could you please press in? Good. Good. Breathe out. Okay, wonderful. Now, please breathe in and out. Good. Once again, breathe in. Wonderful. Would you please turn around? Thank you. Again, breathe in. Would you please hold your breath? You can breathe out. Okay, wonderful. Would you please try to cough for me? Okay, great. Well, everything seems to be just fine, the way it's supposed to be. And I guess that we can proceed further. So, let's check your eyesight, okay, if you don't mind. Could you follow the light for me, please? Please follow it with your eyes only. I would appreciate it if you don't move your head. Just trace the light with your eyes only. Perfect. Okay, now I will ask you to look at my nose, okay? Just in the center of your field of vision, that would be my nose most probably. So just at my face in general, and let me know when the light appears in your field of vision, okay? Good. Keep on looking at my nose, please. You can simply nod to me or say something or raise your hand, doesn't really matter. Wonderful. Good. Okay, amazing. Good. Okay. And once again, amazing. Wonderful. Well, thank you. Now, I will put on my gloves. Let me touch your face slightly, okay? I will be very gentle, I promise. I will just check it. Can you feel my both hands symmetrical on both sides of your face, of your head? Wonderful. Can I have a look at your eyes a little bit closer? What if I press right here above your eyebrows? It's okay? Okay. What about your ears? Okay, wonderful. Good. Well, now let's test your sight vision a little bit more. I will ask you to focus on my nose again and let me know when my fingers leave your field of vision. Alright. Amazing. Alright, and now look at my nose and tell me when you see my fingers wiggling on either side. Good. Okay, amazing. Now let me have a look at your ears a little bit closer. What if I press here? Is it alright? Good. Now just the other one. Is it okay if I press here? Okay, wonderful. Well, your ears look just fine. Now let's check how they're functioning. I'm gonna make some snapping sounds and you're gonna count them, okay? Good. Good. 3 sounds, wonderful. What about now? 2 of them, okay? Okay, great. Just one. Okay, wonderful. 5. Amazing. Great. Well, now I will whisper some words from one ear to the other one, and you will simply tell me what you've heard, okay? Good. Well, first I'm gonna take off those gloves. think that I'm not gonna touch you anymore, so I'm not gonna need that. Alrighty, just a second. Okay, great. Okay, well, are you ready? So just listen carefully to what I say and try to repeat. Good. Apricot, strawberry, lipstick, pink, wallpaper, Christmas, laptop, notebook, excursion, makeup, makeup, 51, 65, 21, pilot, 92. Now, to make it a little bit more difficult for you, I'm gonna also make some sounds with my hands so that there's some background noise, okay? Good. Good. 124. Spaghetti. Tomato. 200. Earrings. Candlelight. Sweater. 75. Wow, you're doing really good so far. Good job. Alright, well, now let's test your sense of smell. I have some testers with different scents. You will have to give it a smell and tell me what you think it is, okay? Okay, wonderful. Good. So ready? Let's do it. There's no hurry. Take your time. So what do you think it is? Peppermint. Absolutely. Okay. And now, let's take another one. All the bottles look the same. To confuse you. Okay, good. Ready again? Just press in, take your time, it's alright. So, what do you think it is? Chocolate. Good job. Do you like chocolate? Oh, I do. What's your favorite kind of chocolate? mine would be okay. I do like dark chocolate with all kinds of nuts and stuff like that, but I also like milk chocolates. You're not supposed to have a lot of it since it's very high in sugar, but it's really good. It's really delicious. Let's be honest. Well, anyway, let's also check your sense of taste. Okay, so I will just open this bottle and I will drop some amount of this starchy substance onto your tongue. Okay, I will ask you to stick out your tongue just a little. And now just give it a try. Again, there's no hurry. And just tell me what you think it tastes like. Are you sure? Well, absolutely vanilla it is. Good. Well, now let's try it once again, okay? Just with some different tester. Okay. Good. Ready? Let's go. Okay, well, so how do you like it? What do you think it is? The strawberry. Bingo, right. Well, okay, now there's not that much left. Let's check your reflexes, okay? I have this percussion hammer. I'm gonna use it to check on your reflexes. I will hit your elbows and your wrist and your knees really slightly, okay? Good. Good. Okay. Good. Now your knee jerk reflex. Please put one leg over the other one. Yeah, bend your knees like that. Good. Now switch them, please. No. Great. Well, your reflexes seem to be working just fine the way they are supposed to. Good. And also let's check your sensations. They often call this test sharp or dull. There is this soft part of the brush and there is also this harder, sharper part of the brush handle. Can we just appreciate for the moment how shiny and beautiful it is? Right? Okay, so I will ask you to close your eyes and I'm gonna touch your face either with this softer, nicer part or maybe with this sharper part, okay? And you will let me know what it feels like to you. But please close your eyes, otherwise it won't make any sense. No cheating, please. Okay, so have you closed them? Good. Okay. Good. Okay. Once again. So that was dull. That was soft part. Okay. What about now? Oh, okay. That was relatively sharp. Good. Now once again, keep your eyes closed. So how did it feel? That was soft. Okay. Now once again. What do you think about this one? That was sharp. Okay, good job. Well, you're doing really great. Well, I guess that I'll see you really soon. Maybe for more detailed, specialized eye exam, or maybe some kind of